I have been getting so many questions regarding Wellbutrin or bupropion from my post about HSDD, so I'm going to address some of them here. Wellbutrin is a very commonly prescribed medication, and although I don't love it for hypoactive sexual desire disorder or HSDD, as I talked about in my previous video, I do like it for other diagnoses. Disclaimer, I am not a psychiatrist or a psych NP. However, I am trained in primary care. I am licensed to prescribe this medication, and I do prescribe this medication. So here's how I like to use Wellbutrin as a nurse practitioner from a hormonal and sexual health perspective. 1, patients who have depression, technically first-line treatment is an SSRI, like your fluoxetines, Prozacs, Lexapros, sertralines, etc. However, these medications have low libido as one of their major side effects, and fun fact, it is the #1 reason why patients stop taking their SSRI is from their low libido or any kind of sexual dysfunction. If my patient is concerned about the sexual side effects and they fit the criteria for Wellbutrin, I will use Wellbutrin as first-line treatment for depression if it's appropriate. 2, if my patient is not able to get their depression under control with Wellbutrin and requires an SSRI, which is very common, and they have financial difficulties or insurance issues, so they're unable to take Addie or Addie didn't work for them, I will add Wellbutrin to their SSRI regimen to try and mitigate some of the side effects. However, as I said in my previous video, it's rarely a miracle. The 3rd thing I use Wellbutrin for is to help manage my patients' ADHD symptoms, especially if they can't or do not want to take stimulant medications. Wellbutrin can help with executive functioning. Also, if they have ADHD and depression, I likely will start with Wellbutrin just because it kind of tackles 2 things at the same time. I have no doubt in my mind that my psychiatrist and psych NP colleagues have mastered other ways to use this drug, but this is just how I typically use it in my practice. Follow for more sex and hormone content.